Hi, I'm Dr. Jeffrey Surkoff. I am the medical director of the neonatal intensive care unit here at North Oaks.
Hi, I'm Tasha, the lead lactation consultant here at North Oaks, and we're here today to talk to you about a new program called Donor Human Milk. Can I ask you a few questions about it?
Sure.
All right, so what exactly is Donor Human Milk?
So donor human milk is a milk that is actually provided to a patient by someone other than their mother. Donor human milk is actually obtained from the Milk Bank of Austin. That's the milk bank that we use here at North Oaks. Mothers who want to donate their breast milk are actually screened to make sure that their lifestyle meets certain criteria like limitation of alcohol or drug use. And then once the milk is donated from a mother who meets that screening criteria, the milk is then made sure that it's free of any viruses or bacteria with an actual sterilization process.
Gotcha. So why did North Oaks choose to incorporate this program at this time?
So North Oaks decided to incorporate this as it's been well shown that breast milk is the best thing for babies to receive, and most importantly for those premature babies who are at higher risk of complications with receiving formula, that we felt that it was a really good program to offer those babies.
So does every baby delivered here just automatically get that milk?
No, so there are some criteria to meet in order to have the benefits. Obviously, we would like every baby to receive breast milk, but for those babies who are at the higher risk, as I mentioned, they actually will get the donor milk if they are the most premature, those babies who are less than 33 weeks gestation or about 7 weeks before what would have been their due date when they're delivered, and those babies that are less than about 3 pounds.
Okay. What if a mom doesn't want her newborn to have this milk?
So moms do have to consent to having their child receive the donor milk. So it is a program that mothers are able to opt out of. We will obviously have lactation and the medical staff discuss with the family the obvious benefits of receiving donor milk, but if it's something she chooses to not have her baby receive, she does have the right to say no.
Okay. And so what if the mom wants to breastfeed the baby?
Well, we certainly encourage the mother to breastfeed. So we would like for all babies to receive mother's milk. And donor human milk is excellent, but a mother's milk is really the best thing for the baby to receive. So we would actually encourage all of our mothers to provide their own breast milk. And ideally, the infant would receive the milk only while the mother's milk is coming in if she's unable to produce enough milk. So if a mother wants to breastfeed, we certainly encourage her to do so.
Okay. So will the baby be on this milk the entire stay while they're here, or will it be?
So it's usually a shortened time frame. The mothers will, as I mentioned, hopefully provide their own milk, and once the mother's providing enough milk for the baby to receive their nutrition, we will get them off of the donor milk. If a mother's not able to provide enough milk for the whole time, they will actually be transitioned over to formula the closer they get to their due date.
Okay. So is there access to get this milk when the baby is not here in the hospital, or only if they're here?
So at this point in time, there's only availability to receive the donor milk while the patient is here in the NICU at North Oaks.
So if somebody has some extra milk and she's an overproducer, can she donate that here, or how does that work?
So we do receive our milk from the Milk Bank of Austin. Certainly the mother could try to contact the Milk Bank of Austin and become a donor through them, but currently at North Oaks we're not able to accept milk from a mother.
So if the newborn is not in the NICU, can a mom still get this milk for her baby in the nursery?
So unfortunately that's a little bit more challenging as well. So again, our program is really only set up for the patients who are here in the hospital. So for those patients who have been already discharged, they're not able to receive the milk at this time.
And so where can we get more information about this program?
So you certainly can go online and read about the donor milk program through the Milk Bank of Austin, as mentioned, and then certainly they can call our lactation department here to get more information.
All right. Well, thanks for tuning in. And like you said, if you have any other questions or comments, just give me a call in the lactation department, and the number is 985-230-6415.
Thanks.